Imagine using your own body cells to heal injuries, combat chronic pain, even address degenerative diseases without invasive surgeries. This is the promise of the personal cell revolution. Today, we'll explore how the Cell Surgical Network is leading this charge, transforming lives through the power of personal cell therapy.
Doctors in California are pioneering personalized cell therapy using our own stem cells to naturally heal conditions once deemed untreatable or dependent on risky surgeries. At the forefront of this revolution is Dr. Modicchi, a world-renowned plastic surgeon and pioneer in personalized cell therapy.
Personal cell therapy sounds exactly like it is. It's using your own personal cells to help heal your own body. So instead of using medications, pharmaceuticals, you're extracting your own cells from your own body, mostly stem cells, and then re-injecting them into your own body to help heal yourself.
The Cell Surgical Network has grown into a global leader in regenerative medicine, offering training and technology for doctors dedicated to this innovative field.
Personal cell therapy, I think we're just at the tip of the iceberg. The technology, the advancements that we're developing in this field is exponentially growing.
With a network of clinics around the U.S., CSN members use an online HIPAA-compliant database to evaluate all patients seen in the network.
The CSN database is great because it follows up with patient outcomes over a course of 5 years. So we know which procedures work and which ones don't, and that way we can target our procedures to the ones that are most successful. And that way patients know exactly what they're getting into.
Advancements in personal cell therapy harnesses your body's healing power to transform injury recovery, opening a new chapter of hope and possibility.
I'm joined now by Sean Berman. He's the Director of Scientific Research and Operations at Cell Surgical Network. Sean, thank you for being here. Appreciate it. So talk to us about regenerative medicine and how it works.
Regenerative medicine is an exciting field. There's a lot going on right now. But the whole point of it is we're trying to use your own cells to heal naturally. If you look at traditional medicine, it's, hey, how do we mask a symptom or how do we cut something out? But what we're trying to do is restore things to their natural way.
And it's using stem cells. And I think people are confused about what stem cells are, where you get them. Tell them about that.
Absolutely. It's using stem cells from your own body. The most important thing by far and away is we want a cell from you with your own DNA, because that's how your cells communicate naturally. And it just so happens that your stem cells or your fat is loaded with stem cells. And we can isolate those cells from your adipose fat tissue, and we can repurpose them to other parts of your body to promote healing.
And so you guys are about the isolation process?
We're the isolation process, but we're a network of physicians, domestic and international, and we're about the research.
I want to reduce people's anxiety about stem cells, because sometimes when I bring it up, because I'm a fan of this technique, the people go, oh, stem cells, I've heard there's some problem with stem cells. Help people understand that this is not what the press has been reporting about stem cells.
It's not embryonic stem cells, which is where you have the moral and ethical issues with abortion and whatnot. So forget that. We're talking about stem cells from your fat.
And so you do liposuction?
Oh, a mini liposuction. It's virtually painless, takes 15 minutes. It's harder to get my hair cut than to get this mini liposuction procedure. But 15 minutes to harvest the cells. And then there's an isolation process where we can really dig down and get the exact cell population that we want, and then give those back to the patient within, a 90-minute procedure, essentially.
Are there ideal patients?
Yeah, patients who haven't had an obscene amount of scar tissue. Like I said, we can't reverse scarring. If a knee arthritis patient comes in and they're bone on bone, we can't just regenerate that cartilage. We need a signal from the degenerative tissue to tell the cells what to do.
So you need some healthy stuff left behind.
Just a little bit, right?
Yeah, and yet it can repair joints too, right?
We can get a great response in joints. If you have a little bit of cartilage in there, we're getting about an 82.7% success rate in our patients with knee and hip arthritis, which is great.
So like I said, I'm very persuaded this is a very powerful procedure, and it is the future. I've seen so many problems with big surgeries, particularly shoulder. Shoulder's the one that I always worry about. And so I was so happy to have this as an option. I'm really delighted.
Well, it's the natural way the body is supposed to heal.
Yeah.
Right? It's actually not the future, it's the past. This is how your body's healed for multiple millennia.
Yeah.
We come in with, pharmaceutical interventions and surgical procedures that rip the body apart. But if you can harness these healing cells that aren't being used in other parts of the body and repurpose them elsewhere, that's the way the body was intended to heal.
What's the future of regenerative medicine?
I'd love to see more advancement in the neurodegenerative field. But also, there's cell banking, which is available too. You can store your own stem cells and have them for the future. for the rest of your life almost.
In terms of the future, I kind of think that's the future.
Hey, it's pretty cool stuff, and I'm trying to do it already. I get my cells back on a quarterly basis. I'm, knock on wood, trying to
Do you
stay
do it
young and
IV or what do you
healthy.
do?
Do it IV. Just like I said, the cells go to sites of inflammation, and I
And
think
you're,
it's a
and you're
really
what,
powerful
75
thing.
years old? And
I wouldn't lie to you that bad, no. But I'm trying to look like this when I'm 75 and feel like this when I'm 75.
Well, congratulations. It's very important
Thank
stuff.
you.
Really interesting. For more information, visit Cell Surgical Network, one word, cellsurgicalnetwork.com. We'll be right back.